All right. So again, I'm Jennifer, membership chair of BHN, and today we have Forrest giving us a presentation. He is our mental health resource professional, and he has brought on a co-presenter that should be here in any minute now. But Forrest, if you want to go ahead and reintroduce, I think this is everybody's first introduction to you, right? So
Yes, I believe so. Hey, everybody. As Matt mentioned, my name is Forrest Lovell. I'm new to the BHN team. My background is in like nutritional psychopharmacology and psychopharmacology. Basically, just means that I have an emphasis on using plants as my medicine for mental health purposes and holistic care purposes. I finished my undergrad and then was able to conduct some research on cannabis and type 2 diabetes, looking at the behavioral and physiological implications of cannabis as a true treatment modality for type 2 diabetes. So our conversation today will center around continuous glucose monitors as a treatment modality for diabetes and the behavioral health, mental health aspects that play a role within that care.
actually, Forrest, are you the one that has the slides?
Yes, I do.
Okay. I should have done this before we got started. Sorry, guys. It's going to make you the co-host, but it's not letting me
I know.
try it this way. There we go. Oh, there we go. Sorry, guys. Okay, that should be good. And then while he's getting all of that set up for us, I just meant to mention to y'all that we will have that question and answer where y'all can come on camera or come off of the mic at least. But if you do want to remain anonymous, you can shoot me a private message and I'll read your questions when they are done. Is it letting you do it?
Just share the screen.
Yeah.
I think so. I'm using my iPad, so I think it's being a little cumbersome here. Okay.
Perfect.
Is everybody able to see my screen?
Whew, you got a lot going on there. There you go. Yeah.
Sorry.
No, you're good.
See. So again, my name is Forrest Lovell. My co-presenter is Karen Liu. She is a researcher, clinical researcher, and diabetic educator and nutritionist at the Joslin Diabetes Center for Harvard in Boston. She is also my mentor. I met her at Quincy last year. She is passionate about cultural humility and cultural acceptance within healthcare and how we can better bridge the gap within the biases and within the care and access for our clients. She also conducts research, as I stated, and she's been in practice for, I want to say, 13 years now. So the things that we're going to talk about today are different types of diabetes, how diabetes and continuous glucose monitors and their use specifically can impact your mental health, how RDs can play a role within that to support mental health and things to look out for, concerns that arise with continuous glucose monitor use and mental health within patients, and other ways that RDs can help make this a more accessible form of healthcare. So the most common FORPS types, I'm sorry. Oh, and I also apologize. I have a stutter. So if you're ever having a difficult time understanding what I'm saying, please just drop something in the chat or raise your hand and I'll gladly repeat what I'm saying.
Hey, Forrest, I just wanted you to be aware that Karen did jump on a minute ago.
Oh,
Just so y'all have
perfect.
your stuff set.
Hey, Karen.
Hi, nice to meet you. Sorry for hopping on a few minutes late.
No worries, no worries. I
There
need to
you
go
go.
back, but I think it's just letting me go forward. There we go. Okay. So I was just going over the objectives and what we were going to talk about today. And I already introduced you. Would you like to say anything else?
I'm sure my introduction is fine. So don't worry about it. Let's keep going.
Okay, sounds good, good. So I'll let you go from here. We were just talking about the types of diabetes that we'll be covering.
Sure. So like, thank you for having me today. I'm very passionate about using the technology of CGM in helping people with diabetes. I'm a diabetes educator working in Boston and out in Joslin. So this is a very quick recap of diabetes. I know that you know about what diabetes is. So there are four main types of diabetes. There are more than that, but like these are the main types of diabetes. So type 1 diabetes, which is an autoimmune disease. So people have to manage the diabetes with insulin. And for type 2 diabetes, which is the most common type of diabetes, the first line of management is through lifestyle, which means like healthy eating and exercise and sleep and all that. And diabetes is a progressive disease, so they might need to add more medications as they have their diabetes for a longer time. So for example, they may start off with oral medications and then there with some GLP-1s medications. So some brand names are Ozempic, which probably you have heard about it, and Trulicity, and they might also need insulin. For gestational diabetes, this is the type of diabetes that happens during pregnancy. And oftentimes, diabetes will go away after the baby is delivered. And for gestational diabetes, the management is through lifestyle as a primary management. And people might need insulin if they can't just manage through lifestyle. And the other very common type is prediabetes, which is when the blood sugar is slightly higher, but not high enough to be classified as diabetes. And for prediabetes, that is managed primarily through lifestyle. And its most effective way of managing is lifestyle. And so we talk about CGM because it can affect all these type of diabetes. So historically, CGM has been used for people with type 1 diabetes. But as the technology's been advanced, getting easier to use, getting better coverage, there are more people with type 2 diabetes are using it. And there are also like a lot of more studies showing that like it might also benefit people with gestational diabetes and prediabetes. So that's why it's good for us to, be aware of this technology. So then you can help with your clients better. So next slide, please. So if you're not familiar with continuous glucose monitors, or in short CGMs, which I'll be using that down the next few slides, it is as the name is implied, a monitor that measures the glucose continuously. So it measures the interstitial fluid, which is the blood sugar of the fluid within cells. So it's not the blood itself. So if you are not as familiar with CGMs, when your patients or your clients are using CGMs, they might notice that CGM number has a little of lagging than the numbers that they typically use in finger sticks. And that is totally common because the interstitial fluid, it takes a little bit longer to reflect the blood sugar. So that is totally normal. And the benefit of CGM is that it provides real-time updates. So it gives you the number right away. Depending on devices, it can be updated every minute, or it can be every 5 minutes or 15 minutes. So entirely depending on the CGMs. And for the CGM, it basically, when we're talking about it, we're talking about this whole system, that there is the sensor, which is the one that is attached to the body, measuring the interstitial fluid, the glucose level. And then there's the receiver. So the receiver can be a standalone reader that gets the number, or more often these days are using a phone. So whether they have a receiver or not, it's personal choice, or because of the insurance coverage. So if they are on Medicare, they are required to get a receiver in order to get their census to be covered. And for the system, there might be also a transmitter. So historically, transmitter always exists. So you have put on sensor and then put on the transmitter, then the numbers can be sent to the receiver. But now with the technologies advanced, wearing CGM is much easier. The sensor and transmitter typically are together, but there are some CGM systems still requires a transmitter. So, and I'm going to tell you what are some of those CGM systems. Yeah, so that's one slide back, please. One slide forward. Let's see. Yeah, there. So like I've mentioned, like CGM has really changed a lot. So it started off in the 90s that we have a very first CGM. So in the beginning, it's quite cumbersome to use it. Like people still require to do finger sticks to calibrate the CGMs. Like it can be 4 times a day, and it's not that convenient. So that's why it was less used. I mean, oftentimes for people with type 2 diabetes, they don't even prick themselves 4 times a day. So if they have to wear a CGM and pricking themselves 4 times a day, it's, you can imagine no people want to use it. But now like, you can see like over the past 10 years or so, the technologies have really advanced. So now CGM can be a standalone, so they don't need using a blood sugar finger sticks to measure the blood sugar again to confirm the numbers. So they can just use the CGM to decide how to treat their blood sugar. And now that the technology is advanced, that most of them do not need calibration. So that means once they put it on, they don't really need to do a finger sticks unless there are certain situations, such as if they think the CGMs are really off, the numbers are really off, or how they feel and the CGM numbers are not matching, then those are the times that it's still advisable to do the finger sticks, but otherwise it's super convenient. That's why like CGMs are getting more and more popular. So next slide, please. So if you're not in the world of diabetes, here are some most common types of CGMs that you might see. There are different companies. One is Abbott. So their CGMs are under the name of Freestyle Libre. So the ones that are still quite popular on the market are Libre 2 and Libre 3. But you might still see people using the very first generations, Freestyle Libre or Freestyle 14 days. So those are older generations. And Libre 3 is the most recent ones. And Libre 3 Plus is the one that typically used when they are matching with a pump. So using a standalone, oftentimes it's just Libre 3. Coming soon are those. So all these Libres, or I mean, these CGMs that I've just mentioned, they require prescription. So historically, you do need a prescription in order to get a CGM. So starting this summer, there are CGMs that are coming out or have just came out that does not require prescription. So you can just order them online, over the counter to buy them. So for Abbott, there are 2 of them that are coming out soon. There have been FDA approved. My guess is probably coming out by the end of the year. That's what they have been marketing. So they're called Lingo and Libre Rio. So Lingo is for wellness measurement. So they're targeted people without diabetes, just to get a sense what their blood sugar is. For Libre Rio, that is for people that is not on insulin and to measure CGM. Measure their blood sugar. The other big brand that has a lot of people using is Dexcom. So G6 is the older generation. G7 is the most recent generation. You might still see G6 around, especially those who are using their Dexcom with the pump, because right now still G6 is the one that is most likely linked to the pump. And they also have just came out with the over-counter without prescription CGM. So that is called Stato. So I think they came out about a few weeks ago. So they started shipping out online if they buy it. The other one is called Sensonics. Their CGM is called Eversense E3. You might not see that as often. So this type of CGM is actually an implantable CGM. So they have a sensor that is implanted into their body that can be used for 180 days. And then they will put on a transmitter over the top, and then they will use a reader, which is a phone, to read the numbers. So this is slightly less common, but they are available. For Medtronics, the Guardian one is what they typically use. Most people use the Medtronics with their pump. They do have a standalone one, but it does require calibration. Just a few weeks ago or last month, they also got an FDA approval for a newer CGMs coming out later. It's called Simplera. So I haven't got a hand over it, so I don't know exactly how it looks like, but based on what I read, it seems like it's going to be simpler, much easier to use. So we can keep an eye out to see what they're going to be like. So those are the CGM and diabetes basics. And Forrest, would you like to take over this part?
Yes. So now we're going to talk about more of the factors of how mental health and behavior play a role with continuous glucose monitor use, CMU use. So how does CGMs impact diabetes management? It allows for real-time biofeedback, so patients, clients don't have to rely on sensations of hypoglycemia. They're able to rely on actual metrics to inform their choices and how they go about their care. And that also gives real-time feedback or real-time biofeedback back for their providers at the same time. In addition, the coverage of Medicare and Medicaid with these products allows for more individuals to be receiving care for their diabetes, and that's more people who are receiving accessible care to diabetes care. What are the mental health benefits associated with CGMs and diabetes? So I want to be clear that the data that's out there, the literature that's out there, suggests that there is a benefit of using CGMs on that mental health, but they're not. I want to say clear as to how significant the link is between the two. But through the research, they've now noticed increased patient autonomy. They're able to better analyze their diabetes status and address their lifestyle factors. RDNs are able to increase patient knowledge and use the CGM as a tool to help patients learn how to manage their diabetes better and learn more about diabetes and other healthcare factors. And current literature suggests that CGM paired with counseling should be considered more as a behavioral tool than anything else, because it helps train the individual on how to engage with food, nutrition, and other aspects of life. There has been shown to be a decreased fear of hypoglycemia because clients are able to see the real-time biofeedback through the app or in speaking with their doctor if they use the 2-week glucose monitor system. And they're no longer relying on sensations or hoping that they feel sensations, because after time, clients become habituated to the sensations of hypoglycemia. And like I said, they're able to regain hypoglycemia awareness in an actual sense, not in a perceived sense. In addition, clients are experiencing ease of mind. Apps are able to provide exercise suggestions. They're able to clearly show all of the data related to their glucose numbers, and they're able to make customizable features or use customizable features such as alarms when to take insulin, when to eat, or as Karen mentioned earlier, when to follow up with a blood cyst or finger cystic test to check their glucose that way. There are many apps like the G7 and the Freestyle Libre have a social component where you can meet other users of the app or other people who have continuous glucose monitors, and allows people to find a sense of community and a sense of network through that. There's also the option for secondary monitoring with professionals that can either be shared with the healthcare team, doctor, nutritionist, or it can be shared with the patient or clients or relatives. So this helps manage their diabetes care in a more efficient way, in a more holistic way. And there are multiple continuous glucose monitor options for people. If they're more tech savvy, if they're less tech savvy, if they want more of the customizable features, or if they rely on assistance through supportive features that can aid individuals who experience cognitive decline as related to diabetes or the development of type 3 diabetes. Other factors associated with its use, as I stated, the current data is unclear if the relationship between continuous glucose monitor use to manage diabetes and mental health is a significant one or not. But the data does suggest that patients do experience lower diabetes distress, lower instances of depression as related to diabetes management, and lower perceived issues and barriers as related to treatment. Now, what are the concerns related to CGMs? Because it's not all rainbows and sunshine. Clients have reported to exhibit anxiety and feelings of being overwhelmed due to the sheer amount of data that's available. They're also more inclined to experience disorganized eating as related to having the data and trying to monitor their blood sugars with that. There is the diabetes risk quotient that is used to identify diabetes distress within patients, but that scale does not look for disorganized eating and symptoms of binge eating or other eating disorders. So healthcare professionals, nutritionists especially, need to be mindful of that and make sure they're having conversations with their clients to check in with where they're at. The companion apps do not provide insight to managing the diabetes, which is great in one sense because it continues to encourage patients to rely on their healthcare professionals, either their physician or the nutritionist that they're working with, but it doesn't provide immediate feedback if they're not able to get a hold of their provider in that sense. And as I mentioned, there's experienced diabetes distress. Clients become preoccupied with trying to manage body image as it results to wearing the continuous glucose monitor and the perception of others. They struggle with the sensation of having to apply the monitor, and they struggle with consistency in being able to use the app. As a relation of all of these factors, they experience decreased confidence in how they're able to manage their health, manage their disorder, and feelings of self-worth, which is something that we need to be aware of. Are there other access or barriers towards treatment? Unfortunately, there are. One of the biggest ones is cost of coverage for this type of treatment modality. If individuals are not covered through Medicaid or other private insurance and are not currently receiving insulin, they are not very likely to have it covered through insurance, which means they would have to pay out of pocket. And Karen, do you remember the estimated quote for out-of-pocket costs for one of these?
Sure. So for like the classic Libre and Dexcom, they're at least, I'm in Massachusetts, so at least for Massachusetts is about $130 per month. If they're getting the over-the-counter one, it's about $100 per month.
So that cost is it adds up over time on top of regular treatment modalities for insulin and other medications. So that is a major concern. Another concern that clients experience is higher perceived inaccuracy of glucose readings, high costs, frequent annoyances of alarms, and insertion pain, as I mentioned earlier. The higher perceived inaccuracy of glucose readings has not necessarily been founded, but clients do still have that fear. So that's where RDNs can step in to help bridge that knowledge gap with clients. And then also assure them that they have alternative ways to monitor their glucose if they truly are concerned about that. The last factor that is a barrier, I apologize, barrier of access towards treatment with CGMs is ableism. Patients, clients may experience stigma from other individuals when they wear their CGM. There's judgment regarding how they may manage their health and the type of person they are through morality, based off of discrimination and ableism. For other aspects, there's sometimes discrimination experienced as a relation of their peers in the workplace. And diabetes is counted as a protected disability through ADA. So it's important to help clients and their families and support network understand that they are protected under this class of disability and that they do have options if they experience any harassment. How can CGMs elevate your practice? There's a couple ways that it clearly elevates practice. Patients, clients are able to access treatment, and more individuals who have access to reliable treatment, the less likely they are able to complication of diabetes in the future. There's decreased diabetes distress within clients, which lowers the tax that it costs on the healthcare system and puts independence back into the hands of the clients. And there's a large client and provider network that can be accessed through the companion apps for most of the CGMs. They have both social networking, and they have as well treatment networking. How can RDs help battle the burdens experienced within this area of healthcare? The first is to bridge the educational gap that's experienced between clients and practitioners within the use of CGMs for type 2 diabetes and type 1 diabetes, as well as help provide community education to help decrease the stigma. Another way is to screen clients with the diabetic distress tool that helps to determine if a client is more likely to experience stress as they treat their diabetes, and that help determines which type of CGM should be chosen for the client, as well as if the inundation of information may potentially be too much for them, as well provides the practitioner, RD, or the physician options to be able to look out for some different factors of diabetic distress and disorganized eating and possible development of eating disorders. If clients do exhibit symptoms of diabetes distress, more so specifically emotional distress, disorganized eating, and other eating disorders, it's recommended that the client is referred to a clinical psychologist as well as their physician to seek for further care. Another thing that RDs can do is attend webinars regarding ADA and diabetes to help provide clients with the information that they need to be able to understand their rights and protect themselves in situations where they might face that stigma or discrimination either in the workplace or in other areas of their social life. The last item there is to incorporate motivational interviewing to help develop the client's sense of independence and confidence, because they can utilize these different systems. As Karen mentioned earlier, companies are coming out with more tech savvy and tech friendly interfaces for individuals. It's just about allowing RDAs to help find the right system for their client. Other ways that RDs can help is to foster positive sentiments regarding body image, the disease management, and their relationship to food. As I stated earlier, clients experience body dysphoria or dysmorphia as it relates to having to wear the CGM and the physical discomfort of insertion. Talking about that, getting familiar with it, weighing out the pros and cons, and the cognitive dissonance around that is very important in order to help clients use this as a long-term form of diabetes management. Lowering the stigma around CGM wear, again, whenever you're engaging with a client or you're engaging with the community about these topics, it's important that we're fostering a positive behavior and positive mindset around its use and around its implementation with diabetes management. And the last way is to increase access by discussing CGMs with clients with diabetes before they are even given the option by their RD, or not by their RD, by their physician. As we mentioned, patients who are on insulin are only eligible for coverage through insurance. So if we're able to talk to patients prior to that, at least they can perform a familiarity with this type of treatment modality and this tool for treatment. So when it does come time for them to implement it within their treatment modalities, they're more comfortable and they're less likely to experience the distress and body image issues. And that ends our conversation today on mental health and diabetes and continuous glucose monitors. If you would like to access any of these references, we can drop them in the chat for you all. And now we can open it up for any questions.